With Medicare for All being a pivotal issue, we asked Dr. El-Sayed how he intends to persuade rural voters about the importance of healthcare reform, especially considering recent polling trends in the area. He had previously advocated for Medicare for All during his gubernatorial run in 2018.
So let me just step back for a second and recognize that it is a crazy thing that folks have to drive 250 miles. If you have a heart attack, that's basically a death sentence. And the way that the proponents of quote unquote more privatization have moved is that they want to now gut Medicaid. A disproportionate number of children here in the UP get their health care on Medicaid. And it's not just direct health care. It's services provided through schools. It's 80% of the mental health infrastructure. It is a critical lifeline for folks across our state, in particular in rural communities like this. If they go on and gut Medicaid, it might mean the end of some of the few hospitals that you even have here that are open. To me, I believe that everybody should be guaranteed access to the health care they need and deserve from the moment they're born to the moment that they breathe their last breath, and hopefully after a long, healthy, productive life, right? And that's because they got the health care that they needed when they needed it. Didn't matter if they turned 26, didn't matter if they got married, didn't matter if they got divorced, didn't matter if they got a job or lost a job or turned 65, that would be there for them. That to me seems like an obvious thing that we should be able to do in the richest, most powerful country in the world. And the reason we can't do it isn't because you have private health care, it's because you have private health insurance. And I'll be clear about that, right? Under Medicare for All or guaranteed health care or whatever you want to call it, the idea is that health care stays private, right? So the hospital you go to is still a private hospital, right? Or a nonprofit hospital. But everybody has equal access to that hospital because they don't have to worry about what kind of health care that they have. And there's no gatekeeping around being in network or out of network. You get to pick your doctor and go to that doctor. But what's most important for communities like this one is because everybody in that system would be an equal healthcare consumer, that they would be able to go to the hospital they're choosing and they would be able to direct their funding into those hospitals. One of the challenges we have with our current system is reimbursements on programs like Medicaid are just too small. And so a lot of these hospitals get choked out for services because you have such a high proportion of people on Medicaid in the first place. Gutting Medicaid isn't the solution. Empowering people to have the health care they need and deserve just as a function of being here in the richest, most powerful country in the world, that is the solution. Now, I think part of that is you're right, like people don't quite understand what you mean when you say Medicare for all, et cetera. My point is this, that you should have guaranteed health care, that it shouldn't be able to gatekeep you. You shouldn't have to worry about getting your paycheck garnished every 2 weeks or 4 weeks by a private healthcare company, only to have to pay a deductible, which on average is $4,000 for a family of 4. The average family in the UP here earning under $80,000 a year, which means that they'd have to lose their paycheck for a month just to be able to get the health care they thought they already paid for. You wouldn't have a situation where you have huge medical debt like we have in this country, $225 billion of medical debt. Just to put that in perspective, that's more than the GDP of half of the states in this country. That's the system we have right now. And you should ask yourself, is it working for you? Is it actually working? Do you feel secure in your healthcare access? Do you believe that the hospital that's there for you right now will be there for you tomorrow? Do you worry about having to wait a month, 2 months, 3 months to go see a doctor that you need to see today? Are you certain that you're not going to go into bankruptcy or at least into debt because you decided to go see a doctor when you or your loved one got sick? If it's working fine for you, great, but it's not working fine for the largest proportion of people in this country. We can and should and must do better. And as a physician who worked in health departments, who literally wrote the book on Medicare for All, I'm running in large part because I think it's a fundamental injustice that if you live in a place like this or you live in a place like Detroit, that you don't get the health care that you need and deserve, that despite it, you're told that you have the best possible health care in the world, and we're just watching it get worse because there's greed on every side of it. And to me, I didn't get into health care because I wanted to make money for a large corporation. I got into health care because I wanted to take care of people. I think everybody in this conversation deserves to know that the people who are fighting for them are fighting for that access. And with me, that's always what you're going to get.